I'm Gene Liu, and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles. And I wanted today to talk about post-tonsillectomy pain control. Getting your tonsils out is a really tough recovery. You've probably heard a little bit about it through family or friends who've gone through it. After the surgery, you've got open raw areas in the back of the throat that take about 2 or 3 weeks to heal. During that time, every little yawn, every little swallow is going to hurt. On top of that, everything you eat or drink goes past the area and can irritate it as well. For this reason, almost everyone needs pain medicine afterwards. As a general rule, the younger you are, the less you're going to need, but everybody's going to take something. I recommend starting off with a foundation of Tylenol and Motrin marched around the clock. You're going to take Tylenol every 6 hours, Motrin every 6 hours, but if you alternate the two, you're going to take something every 3 hours. So imagine Tylenol at noon, Motrin at 3, Tylenol at 6, Motrin at 9. Just march that out. At the beginning, even before you get to the 3-hour mark, you're going to be looking at the clock waiting for when you can take the next dose. Gradually over time, that interval is going to space out. So when you get to 3 hours, you're not so bad, but you start watching the clock at 3.5, and then 4, and then 4.5. If you need to in the first few days to compress so you're taking something every 2 hours, meaning Tylenol every 4 and Motrin every 4, that's okay, but it's not something that you can do for a very long time. If the foundation of Tylenol and Motrin isn't quite cutting it, then I generally prefer giving a prescription for a narcotic like morphine. If you give the narcotic, it's on its own schedule. It doesn't replace the Tylenol or Motrin, but once you give it, it's on its own schedule, and then when you don't need it anymore, it's the first thing you get rid of. Narcotics can sometimes be constipating, cause nausea, cause a little grogginess, so it's nice if you don't end up needing it. Because narcotics can be constipating, if you end up taking a lot, you may also want to have handy some Colace or other stool softener over the counter. In general, the younger you are, the less likely you are to need the narcotic. So most kids under 3 or 4 usually do fine with just Tylenol and Motrin. Adults, on the other hand, are almost always taking all 3 medications, including the narcotic, around the clock for at least a few days, if not the first week. It is not unusual to get a prescription sometimes for a combination drug that includes a narcotic and Tylenol together. An example would be Lortab or Norco or Vicodin or Percocet. If you're taking one of these medications prescribed by your doctor, you can take it and alternate with Motrin, but don't take Tylenol on top of it. It already has Tylenol in it. Historically, because of a concern for increased bleeding with the use of Motrin, ibuprofen, Advil, Aleve, or other non-steroidal anti-inflammatory drugs, many surgeons have recommended against the use of these drugs. Most studies in the medical literature these days suggest that it is okay, and there's been a little bit of a paradigm shift where now most ear, nose, and throat doctors are okay with it. Ultimately, before you start taking these medications, discuss with your surgeon. In the past, codeine was also a frequently used medication postoperatively for the control of pain, especially in children. Whether it was codeine by itself or Tylenol with codeine, that practice should be essentially stopped at this point because there is an FDA black box warning about the use of codeine in kids post-tonsillectomy. It's not absolute that you can't take it, but it should be in very rare circumstances, so please discuss this with your surgeon as well if it comes up. Your goal postoperatively isn't pain-free. That's not going to be possible. The only way any patient ever feels zero pain is if they're snockered under anesthesia with a breathing tube and a ventilator in the ICU for the entire time. What you're shooting for is that it's reasonably comfortable so that you can get some sleep, you can get some rest, and most importantly that you can drink, get liquids down to stay hydrated. During the recovery process, if you're taking narcotics, you've got to take a few precautions. Because they can make you a little groggy, can impair your judgment, we don't want you to sign any legal documents, drive, or operate heavy machinery. As far as topical sprays or gargles, there are some numbing agents that come in those formulations, but they sting like crazy when they go in. They numb for only a few minutes and then wear off. It's not worth it. They don't work that well. Additionally, the amount that you need to gargle with and the amount of drug that gets absorbed in your system can increase the risk of abnormal heart rhythms. So topical agents are something that we almost never do.